Hi, everyone. I think we're going to go ahead and get started, right, Chelsea? Awesome. So, good evening and welcome to the Fall 2021 Community Health Symposium presented by the Albert Schweitzer Fellowship here in New Orleans. My name is Grant Roderkus, and I'm a Schweitzer Fellow and a second-year medical student at Tulane. I'll be our host this evening, and we're so excited to have two Fellows for Life or program alumni with us to talk about mutual aid in disasters. So welcome, Kat and Nancy. As we get started, a few housekeeping items. Please keep your mic muted and use the chat to share any questions or comments that you have about the discussion that we're having. Another current fellow, Lisa Cam, will be moderating the chat tonight. And then take a moment now, if you would, to introduce yourself in the chat with the name of the school or organization with which you're affiliated, your role there, and your connection to the fellowship if you have one. We can give folks a second there, and then awesome. Thanks, Chelsea. So before we begin the actual programming tonight, I'll share a brief overview of ASF NOLA. The Schweitzer Fellowship immerses a diverse group of graduate students in a mentored experiential learning and leadership development program designed to increase our skills and commitment to more effectively address the health needs of underserved communities. In addition to conducting individual service projects, each year fellows work together to organize public outreach activities like this symposium to raise awareness about pressing community health issues. And tonight we're hosting a conversation about mutual aid in disasters with two alumni of our program. So mutual aid efforts have proliferated during the pandemic, of course, especially where and when systems have failed people. Communities have relied on members of their own communities for critical support. So we'll hear about the practical barriers to mutual aid in response to disasters, as well as the unique opportunities mutual aid offers to a group of people connected by more than just a pandemic or a hurricane. And before we hear more from our guest speakers about tonight's topic, each current fellow will present a brief overview of their project and share a tip or a lesson or even a discovery that they've had about effectively engaging with the community, particularly during disasters. And I'll start with my own project. So for my fellowship project, I'm addressing untreated age-related hearing loss among older New Orleanians, working with an amazing group called the People Program that offers a really affordable community building, but education opportunities for older adults. And over these months, I've discovered a community that practices mutual aid within the New Orleans People Program itself. I've lost count of the number of people who've actually participated in my project's activities on behalf of another person. And sometimes it's a family member, but commonly it's a friend who plays an important part of their own social circle and who needs to be able to hear and communicate when they're responding to a disaster like the hurricane we just went through. And now I'll hand it off to our next fellow, Jinx.
Thanks, Grant. My name is Jinx Frederick. I'm a second-year MPH in tropical medicine student at Tulane University. For my fellowship project, I'm addressing gender and racial bias in citizen CPR administration to women, particularly women of color who experience the worst health outcomes following a cardiac event, in partnership with Heartbeat NOLA. Project strategies and goals that we have are to normalize CPR of women utilizing fabric breast attachments of natural skin tones for skills training, to provide educational materials via social media on gender and racial biases in citizen CPR and how to overcome those biases. And we hope to develop a curriculum on bias awareness and out-of-hospital CPR. A community engagement lesson that I'd like to pass on is that there's a strength in being vulnerable and personal when reaching out to engage with communities or partners. As a woman who has personally experienced cardiac arrest and relies on those around me to be well trained and free from a gender bias if I ever have a requirement for citizen CPR. I've been able to utilize my personal experience as a way to build trust with partners in the communities, particularly the women that we would like to work with and continue to work with. And I'm going to pass it on to the next fellow, Lisa Cam.
Thank you, Jinx. That was a very warm introduction. My name is Lisa. I am currently a second-year biostatistics master's student at LSU HSC. For my fellowship project, I am currently addressing relationship abuse prevention, and I'm in a partnership with STAR, which stands for Sexual Trauma Awareness and Response, which is a bit of a long name. For my project, I have several goals, and we have a couple of strategies to try and reach those goals. So of these strategies, we are trying to develop STAR's social media presence, which is extremely important into reaching out to a lot of the youth at risk that we want to engage and trying to figure out, okay, how are we going to improve things in school and then implement this into a curriculum for youth organizations and schools. And then we also wanted to increase awareness of other related topics such as trafficking, and I think last month was LGBTQ runaway homeless youth awareness. So that was something that I had to do. And one community engagement lesson that I learned is flexibility. Anything can change, anything can happen, especially if you do become a fellow. And a really key component is to learn how to adapt to changes. And that's something that I was able to do with the help of my mentor and by reaching out to people when you need help. And so with that, I'd like to hand it off to our next fellow, Jonathan.
Thank you. Hi, everyone. My name is Jonathan Alute. I'm an MD MPH student at Tulane University. I am co-partnered with my co-fellow Marcus Moses. For our fellowship project, we are addressing prostate cancer disparities among Black men in New Orleans.
Hi, everybody. My name is Marcus Moses. I'm an MD MPH candidate at Tulane. And just to continue what Jonathan was saying, our goal with to address prostate cancer disparities is we're working with local Black churches and barbershops to implement culturally tailored educational interventions. And our overall goal is to empower Black men through prostate cancer education and advocating for healthy cancer prevention behaviors such as PSA screenings and regular primary care. And I think the biggest thing that Jonathan and I have learned so far with working with the community is don't be afraid to immerse yourself and really engage with the community. They really want to see us firsthand exposure, and just by going to their local events and getting to know them on a regular basis, I think has really helped us. And one of the biggest things we've tried to do is really to keep up with the people that we're working with and to make sure that their needs aren't just meeting our needs and we're meeting their needs at the same time. So just don't be afraid to immerse yourself into the community.
And with that, we'll pass it on to our other fellows, Lauren.
Hi everyone, my name is Lauren Wynn. I am a third year MD MPH student over at Tulane, and I'm partnered with Will Bowles, who is an MD candidate in his third year over at LSU School of Medicine. The name of our project is our project site is Southern Woman with Amazing Purpose. And our focus is establishing a peer-led mental health resource for formerly incarcerated women. To be more specific, establishing a peer support group for formerly incarcerated women, focusing on building self-sufficiency and processing trauma. And so the way we're going about that involves 3 strategies. And the first being that we hope to execute a focus group for formerly incarcerated women, which we're very excited about happening just next week, to be able to understand the kind of struggles that formerly incarcerated women face during reentry, as well as the strategies that they've used to be able to get over that hump and what their strengths have been. Secondly, we will be developing and formalizing a curriculum that's already been written into a more structured program manual using the information that we learned from the focus group. And then finally, we'll be executing a pilot of the program manual that is led and facilitated by Dolphinette Martin, and hope to be able to then evaluate the pilot and use that data to establish it either within prisons and jails or outside for women and girls who are at risk of incarceration. And I'll say one lesson that we learned regarding community engagement, especially in the context of talking about mutual aid during disasters, is the importance of meeting people where they're at, both physically in terms of, having to drive, whether it's 30 or 40 minutes or 2 hours to get to wherever they are, and then also letting them direct what exactly their needs are and letting them dictate exactly how other people can be helpful to them. So those are some useful lessons, and thank you. I'm excited for the rest of the talk.
Thanks so much,
Awesome.
Lauren. I noticed that Will just jumped on. Will, do you want to add anything?
Hi everyone, I'm Will. I don't know if we're doing the introduction bit, but I'm third year medical student at LSU School of Medicine. And yeah, I have nothing to add about the project other than it's been really great to work with Miss Dolphinette. And just a community lesson I've learned is that, similar to what Lauren was saying, it's it's meeting people where they're at, but it's also about listening to what their needs are. And I really have nothing more to add than what Lauren said. It was just a lot of especially after the hurricane, when you see a lot of the gaps left in the wake of a completely unprepared infrastructure, and everyone just kind of, you saw a lot of people fending for themselves, but you also saw, especially with like Operation Restoration, people really just meeting the needs. And it's as simple as that. Like, if you have it, can you give it, and that kind of thing. And really seeing that kind of solidarity across different parts of the community was really inspiring. And I think, it starts with asking, and then, just bring what you got to the table. That was kind of a rambly answer, but it made sense in the moment.
Awesome. Will, not rambling at all. I think you just described a lot of the key principles of mutual aid, which is why we're all here tonight. So thanks to all the current fellows for sharing some background and lessons that they've learned from their projects. So now it's my pleasure to introduce our guest speakers. I'll keep these intros brief, but I think Lisa's going to go ahead and put the more detailed bios of our speakers in the chat. So first we have Dr. Kat Pattison-Paling. Dr. Paling is a mental health clinician, transformational leader, and community organizer with more than 15 years of experience working with diverse and vulnerable populations, all the way from small nonprofits to large healthcare systems. Dr. Paling is trained in psychology, social work, disaster resilience, and has a doctor of social work from Tulane. She's currently a member on the executive board of directors for the Louisiana Group Psychotherapy Society and on the Fellows for Life Advisory Board here at the Albert Schweitzer Fellowship. And then our other speaker is Nancy Zhang. And Nancy is a registered nurse at LCMC Health. And outside of the hospital, Nancy frequently serves with Culture Aid, which is an amazing nonprofit organization that provides no barrier distribution of fresh food to friends, neighbors, and culture bearers across New Orleans. And Nancy also serves on the Fellows for Life steering committee here at the Fellowship in New Orleans. And she earned her MPH from Tulane and her nursing degree from LSU HSC. So Kat and Nancy, thanks so much for being here tonight. I think before we dive into mutual aid, just to get to know the two of you a little bit better in your own words, can you introduce yourselves by sharing what you did during your time as Schweitzer Fellows and the gaps in services that you tried to address when you were with the fellowship? Kat, you can go ahead and go first.
I was a fellow in the 2015-2016 cohort. I did a partnership project called Allevio, and it was in 2014. A friend of mine in the social work program, Shanoa Moten, both her and I speak Spanish, and we're working with that population in New Orleans. We saw a pretty significant gap in services, and I don't know if anybody remembers what was happening around that time, but this was really the pinnacle of unaccompanied minors coming to the US. So as we were meeting with different service providers, this really became the most important and most significant issue facing this population. So we established a partnership with Catholic Charities Archdiocese of New Orleans, and they had a contract with their immigration and refugee program to provide legal services for minors. So our program, Allevio, which translates to relief, was to provide psychoeducation training that alleviates acculturation stress and trauma for unaccompanied minors and their caregivers. And I'll hand it over to Nancy.
Yeah. Hi, everyone. My project with the Albert Schweitzer Fellowship looked at really women's health services, primary care women health services for folks who were undergoing substance use treatment at Bridge House, Grace House. Previously, the female counterpart to Bridge House, which is called Grace House, for their primary care needs, folks were being shuttled over to the Earhart area in sort of a central city. And they were finding that there were a lot of gaps in terms of what we could offer our female clients in terms of just regular clinic needs. And so we did a twofold experience where we looked at basically setting up a whole new clinic within the Grace House site, which was on Camp Street, and now ironically is a brewery. So, anyhow, so we looked at establishing funding as also figuring out how to do weekly sort of health education, but more health vocabulary acquisition for the residents at Grace House, such that they could interface with the clinic staff in order to better address their needs. Yeah.
Thanks so much. Amazing to hear kind of about the things that you are involved in, and it'll be awesome to put those in conversation with the mutual aid efforts that you guys are involved in now. So let's shift our focus, the focus of the conversation onto mutual aid, and we'll have a bunch of questions that we'll pose to both of you. And so maybe we'll go in reverse order here and start pretty broad. What does mutual aid mean to you? And Nancy, you can take that one first.
Sure. So mutual aid is a concept that can be so big, but can also be absolutely so small. I think it's about aptly assessing the vulnerability of certain populations that we live in. And within these populations and these communities, there are such small swaths of specialized needs, whether or not there's a language barrier, whether or not there is a, do you have papers barrier? There are so many ways in which we can anticipate the issues that may come up such that someone might not ask for help. And asking for help in and of itself, whether it is for food or for healthcare or for a safe place to go, it is so very different for every person, depending on what their attachments may be, what their timings may be. So as far as what mutual aid is, it's I think stepping into a space of vulnerability in order to offer and or ask for help.
And Dr. Paling, what does it mean to you?
I was thinking about the definition of mutual aid as we were talking about this presentation, and I was looking at the National Mutual Aid Disaster Relief Network. Their tagline is solidarity, not charity. And I love to think of it as this idea that we all have skills, we all have resources, whether that's time, money, transportation, that we can connect together, and really having neighbors helping neighbors, right? So it's not about having something that we do as part of our full-time work, but it's something that we can contribute as much or as little as possible, and really coming together to meet everyone's needs.
I think those those two themes of vulnerability and solidarity are so powerful. So now I'm wondering, can we track those into the things that you guys do in your communities? How do the both of you engage in mutual aid right now? What are the big efforts of which you're a part? Kat, why don't you take that one first?
Over the last, I guess, couple of years, I was thinking this actually started for me maybe around the Hard Rock collapse. An organization I was working with provided free crisis counseling to people affected. Some of those were family members of people that were in the building, or neighbors and individuals whose homes were taken away as part of the collapse. So providing crisis counseling as part of my professional role, but also right after Ida, collecting money, just putting that out there on social media, and then purchasing groceries, cleaning supplies, and getting connected with people in the neighborhood who needed supplies, and bringing it straight to them. Because of course, transportation is one of those barriers that a lot of people face. And that was something that I was able to be resourced in. So providing whatever I could in that time.
And how about you, Nancy? I know, I think we're all excited to hear a little bit about the work you do with Culture Aid. So.
Oh, sure. So Culture Aid is a wonderful organization that aligns a lot of different minds in terms of social work, healthcare sometimes, but mostly centered around food and food insecurity here, given that we do live in such a food desert, especially depending on where you are in New Orleans. Culture Aid is a twice a week food giveaway wherein you really don't have to bring anything but a car, and there's also a walk-up line, but basically you go, no questions asked, you get a box of whatever sort of food, usually fresh produce, certain things like, the sort of oil and vinegar type things that aren't necessarily groceries, but they're still very key in the making groceries aspect of living. But we do all this entirely volunteer based, because it shouldn't be hard to ask for help or to get help. And so that is mostly sort of started mostly during the pandemic, because it was something that you were finding that when people weren't working, they weren't able to make money. And when you also are either undocumented or whatnot, getting aid via the government is also quite a barrier. And so it's just a no questions asked experience that works basically between for about 4 to 5 hours every giveaway. And before that, I think I mostly worked within like the Rebuild Center, doing mostly medical stuff, giving vaccines, flu vaccines, Hep A and whatnot for our very vulnerable populations. We have so many unstably housed folks here as well.
Of course, Kat, were you going to jump in there? Did you have something to add?
Oh, I was just saying yes.
Oh, okay. Awesome. Gotcha. Yeah. So, just a reminder to everyone who's here, if you have questions, please put them in the chat. We'd love to incorporate them into our discussion. And Nancy and Kat, please feel free to dialogue with one another too. So to kind of leap off of what you kind of alluded to there about barriers to mutual aid efforts, I wonder if both of you can speak to some of the barriers that you've come into, and then maybe compare and contrast the barriers that exist to mutual aid efforts in normal times, and then the ones that exist specifically in times of crisis after Ida, after the Hard Rock collapse, during the pandemic. What are those barriers, and how do they look in different times?
No, I was really thinking that the barriers kind of look the same in both times. It's just that the disasters have really intensified the need. So all of the barriers that we have, they're just much more intense, and people are much more affected. People still have a need for food, for housing, for transportation, and basic health care, but it's just so much greater now. And I actually saw this meme. I was hoping to, I'll read it. It's broke NOLA people sending money that they ain't got to other broke NOLA people sending money to they ain't got to other broke NOLA people. And it's just this, it's a picture of people just sending, hey, what's your Venmo? Hey, what's your Venmo? And that's very much so what post Ida felt like. I feel like when I made the ask on social media for donations, it was so many people in the community who sent me like $20 or $15. And it really is like so many people wanting to help each other out, even at their own expense at times. So I thought that was a really perfect sentiment. And it actually came from somebody who works in mutual aid or labors in mutual aid, Colleen Murphy, who does the Community Resource Guide for Resistance and Renewal that's had a few different iterations. Right now it's at Anti-Gravity magazine. That's completely volunteer effort of coming together all the different resources in the community, is updated about once a year.
And what about you, Nancy? And what are some of the barriers that you've come into contact with?
Just like Kat was mentioning, I think that there is such an intensified need for transportation, for either to get food or to escape or whatnot. It seems that there are so many resources that just seem even more scarce in a time of disaster. Even things like cold water, ice, stuff that you think, oh yeah, this shouldn't be hard to get, becomes very hard to get. And it's a great question, because you also kind of realize that it's always hard. It's always a challenge. Our situations post disaster just very much highlight a lot of the infrastructural you know, inabilities that we've seen in our city sometimes. God love it, you know. But yeah, I mean, I think that it's been such an interesting thing to sort of see what sort of social contract people feel that they have with their community, you know, what they feel that, what resources they have that they feel that they can offer, you know. The way that I got involved with Culture Aid was because someone asked in a mutual aid group on Facebook, hey, I have this friend who is elderly and he has not been able to get his toenails clipped. And they were at that point kind of growing under his feet and becoming painful to walk on. And it was such an act of extreme vulnerability and hey, can someone cut my friend's feet? Cut my friend's toenails so that his feet don't hurt. And I messaged them and I said, yeah, I can do that. And it's something that, you know, they're like, well, are you an esthetician? Are you, it didn't matter who I was. I knew how to cut toenails. And from there, you just get hooked into this situation where you say, oh gosh, well, what else can I do that someone might need? Can I drive someone somewhere? Can I see this gap somewhere and meet that need? And that's how we got to have Kat in on a lot of our social work things too, because as we were volunteering, she and I, Kat and I had met at a Schweitzer Fellowship event years and years ago. And then she said, gosh, I'd love to have a Spanish speaking social worker on site just to answer questions about Medicaid, Medicare, food stamps and whatnot. And said, well, hey, why not? You know, and so that sort of why not mentality is something that you see a lot of people tapping into and really giving of themselves, which is incredibly heartening.
I love the idea of, you know, some services you're offering are transportation, which, you know, in some cities we really would hope that there actually is a transit, you know, authority that people can use to get where they need to go. And there's Medicaid and Medicare, but you still need help enrolling, right? But then also sometimes people actually just need to be able to walk around and they need their toenails cut. So I'm wondering if you guys can kind of compare or talk about the factors that, you know, are there some services that really are delivered better, kind of in tandem from a cooperative meshwork of different community stakeholders that actually can't be addressed even in a good time if there wasn't scarcity by a public agency or a nonprofit? You know, what are the things that mutual aid is uniquely bringing to the table? And whoever wants to take that.
Well, and I don't know if it's not possible. I think that it isn't the reality. And so maybe mutual aid is the answer to a lot of the barriers that we're seeing, because there isn't that complete need being met with formal services. So mutual aid fills all of those gaps. And I think it does also provide a venue to have conversations about, hey, why is it that Medicaid provides transportation, but no one wants to use it? Is that because it's usually an 8-hour day for that one trip, and they might drop you off at a time that you're going to miss your appointment? And then if you miss your appointment, are you going to be able to go back to that provider again, or do you have to start with a new provider? And it's this network entanglement of barriers that really make living impossible for people. And I think that's something great about Culture Aid as well, is that it's truly no barrier. And I've worked with clients in my full-time work in psychiatric assertive community treatment who choose to go to Culture Aid because of the no barrier. They may even be approved to get food stamps or food bank, food distribution somewhere else, but because they're able to go there without an appointment, if they've lost their ID, they can still go. It just really freeing up all of those different requirements makes it so much easier and really values human integrity, right?
Yeah. Thanks for saying that. Yeah, it's also really wonderfully it's private in some ways because you're rolling up in a car and you're able to pick up for however many families you'd like, so it empowers the people who have a form of transportation to bring back more groceries for their communities or to share with their own neighbors, and they get to sit in their own car. They're not forced to sit in a waiting room where everyone's kind of staring at each other like at a dentist's office. And so there's a sense of them getting to people generally getting to just go on an errand like in normal times, and just pick something up and leave. But since there were a lot of people waiting, and when the COVID vaccines came out, we thought, hey, why not just wrangle in this as a possibility for folks who either don't know how to access COVID vaccines, who maybe don't feel safe going into a Walgreens because COVID at that point was still very scary. It still is quite scary. And being able to leverage the fact that folks would come on a weekly basis, sometimes twice a week. They'd see us, they'd know us, we'd all wave. Some of us, there's always a DJ. So it makes the whole experience very welcoming. And with that welcoming, folks were able to get their questions answered about COVID vaccines or about different resources in the community. We would point people also to Second Harvest and other food giveaways and, clothing drives and things like that. But when it came time to administer COVID vaccines, we partnered with Crescent Care and were able to, just while people were sitting in their cars waiting, fill out their vaccine cards and give them these shots, because we also were able to find them again in either the line 3 weeks afterwards for their second shot, or have them come to Crescent Care at their convenience.
And I imagine you're building the trust with the people along the way, and then taking advantage of the vaccines that you're offering. So we have a couple great questions in the chat. I'm wondering, Will, do you want to go ahead and ask yours live? Do you want to unmute and ask yours first, and then we'll go to Jinx?
Good thing. Yeah, I was just curious, what role, if any, do you think mutual aid can play in challenging the reasons people need it in the first place?
I've definitely seen it be a venue for organizing, for the advocacy, and being that community base, bringing that community back together so that, again, I just think of helping neighbors so that they're connected, and it's sort of restoring that social network and providing time where people feel free and safe to express those opinions and share information. And I think that goes in again to, Nancy mentioned the environment, that there's usually a DJ. I mean, it's just it's a really creative, I guess, environment. And it really says something about the New Orleans culture as well. And I think that's not always something that you get at some of the other more sterile environments with formal systems. So I think there's something about that really creates safety to be able to express yourself and build the social networks back up.
And I think also, do y'all remember when after Ida, the trash wasn't being picked up? Yes, we all remember that. And, that was one of those things where infrastructurally there was quite a lack of being able to do something that in a city you should be able to do, which is throw away your stuff that you're not going to, that you're trashing. And so seeing the way that folks organize around that to address this infrastructural lack was also, I think, a very helpful way to use mutual aid, because by then all these folks had been, using had been saying, hey, I have electricity, come charge here, or hey, I have this, come grab this from my porch. And so I think that it is such a good breeding ground to also voice your unrest. Yeah, I hope that answered your question.
And then I think Jinx has a question about kind of how mutual aid transitions into policy.
Yeah, essentially picking back off of Will's question and your answers, or have you seen any policy changes at the local, state, or federal levels that came out of an acknowledgement of those gaps that mutual aid was filling?
I don't think that I have right now, but having brought up the community resource guide, that started with the Common Ground Health Clinic, which actually started as mutual aid in response to Hurricane Katrina. And that has since become a federally qualified health center. So although that's not a policy change, it is an infrastructure that was built up and created a formal clinic that still provides really good services to the community.
Yeah, I can't summon anything up in that vein, but that's a really great question.
I'm imagining the opposite's often true, right? Mutual aid, it comes in when a policy's gone terribly wrong, or specifically into people. I wonder, Kat, can you speak to? I think you've, from my understanding, you've done some work with community-based emergency contraception distribution. What does a mutual aid effort like that look like, and where have you done it?
Yes, I did that here up until very recently, even through Hurricane Ida, when unfortunately our stock of emergency contraception was not temperature controlled after the power went out. So going through some processes with that, but I was a founding member of the Reproductive Justice Action Collective here. And so we started in 2016. And one of our first projects was Plan B NOLA, so distributing emergency contraception for free. And we did that by delivering it straight to people's doors at first. And then we also partnered with community outposts. So really thinking about those organizations that are embedded in the community. One of them is a community partner of Schweitzer Star, Women with a Vision, and some coffee shops, just different places where people can access things. So with that, it was very much so community-based. Somebody was already doing this with her friends, and it started growing where friends of friends started contacting her, and it was just too much for one person. So that was a pretty exciting development over the past few years, but it is something that has grown into a more formal, not yet a nonprofit, but a sponsored organization.
Does the nature of the service that you're offering, or does the nature of the connection that people can make change when a community, a mutual aid effort scales up like that? What are the things to be careful of when scaling up an effort like that?
Yes, I think there's a lot of things, especially working within reproductive justice was the model that we were working under. So thinking about who's doing the organizing and what are those assumptions you're coming in with versus what is the community actually asking for, and always centering things back into the community. So having that ladder to leadership for people that you're quote serving, right? And we very intentionally refer to people that we provided emergency contraception to as emergency contraception recipients, not clients, not people that we're serving, because we're all sort of on the same level playing field, right? So breaking down those barriers of power structures as well, and creating a space and reduction of barriers that keep people who need those services from participating in the distribution. So collecting funding to be able to provide stipends to people to be able to engage in the work. So some people cannot volunteer their time for free because their time is so expensive, because they're spending it at that 8-hour round trip provided by Medicaid to a clinic, or they're spending it in line for other services or resources. So providing the resources those individuals need to be able to participate in the movement as well.
Nancy, do you have anything to add to that? If not, I think I'd love to ask you a specific question about kind of the many hats that you wear in the community that you're in. We know you're a provider, but also you're a musician, and I think you engage in mutual aid in a couple different ways.
It's, you know, the thing that Kat was just telling me about us all about reminds me of sort of mutual aid. I have a friend who was telling me about what post-Katrina was like and how everyone's refrigerators were just devastated, you know, because of leaving them for weeks at a time. And there was a person in this particular neighborhood who somehow like did not have a great sense of smell. And I think one of the most off-putting things when you have to clean out your refrigerator, I'm looking at mine right now, is the smell. And it's just absolutely wretched. But because this person wasn't really able to smell, it really wasn't as off-putting to them, you know. And so it's like whatever it is that your resource is, whether or not even it is a lack of a sense or something to that effect, can be utilized. And I think that is something to really latch into in terms of, you know, folks saying, oh no, I couldn't do that, or I don't have the time. Yes, but do you not have a sense of smell? You know, there's a lot of ways to engage, you know, depending on your abilities. Anyway, so that's just a sort of slightly silly, but
no,
you know,
I think
point,
or
right?
sorry, Marcus just asked a great follow-up. I'll let him do it, but it's kind of about that introspection that someone does when they're trying to get involved in a mutual aid effort. So Marcus, please join.
Yeah, so I was just, and I feel like this is a very broad general question, because when you think about mutual aid, there's so many things that you can get involved in. But like for someone with minimal experience, like what advice would you share with them if like this was their first initial attempt to get involved, or if they wanted to start their own project? Because I feel like it could be somewhat overwhelming if it's their first attempt.
Yeah, I think that doing any sort of just, you know, before you do anything in general within public health or research, you know, you do a literature review, and in some ways your literature review in the community has to do with asking questions of stakeholders and key partners that you're intending to target, who are, you know, examples of, or who represent well the either specific target audience that you're trying to speak to or serve or collaborate with. Or, you know, it depends. We're always happy to have folks come and package food. And, you know, if you can lift stuff, we'd love to have you. And from there, you can kind of see as you go and experience this week by week. It's more experiential learning and experiential involvement, how things might run a little better or might run a little differently, because everyone has maybe connections. You know, we've had to change sites numerous times. On Wednesdays, we are at church in St. Roch, but the Saturday site has gone from this one old school off of Gallier in the Bywater to this place in Mid-City, to now just in the 7th Ward at the Corpus Christi Church, you know. And I'm sure that it comes from, you know, the resources that and connections that folks have, either volunteers or who are, you know, the leadership, et cetera, et cetera. So there's always such a multitude of ways in which you can, you know, assess a role for yourself.
Yeah, I'd really encourage you to assess, what is your superpower? Is it that you don't have a sense of smell? Or do you have some other skills that are maybe really beneficial that you've developed professionally, and especially folks in the medical field? And where do those fit in? I think that there are a lot of places where you can start doing some listening, whether virtually or in person. There's a few different groups operating, like the community fridges are very active. So people just sometimes bake stuff or cook plates and then go out and place it in the community fridges. There are some Facebook groups that have mutual aid where people can make specific requests, or you can make specific offers. And I'm also thinking about one of the seminal, I think, mutual aid groups in the area is Tristeria, which is mostly a needle exchange, but they do a lot of work in organizing around the idea of what is mutual aid. And I think Chelsea put a really nice response. I don't know if you want to read that, Chelsea. I think that was really well put.
At which response?
Questioning and reframing, like, what does it mean to engage in mutual aid?
Oh yeah, I was actually typing, I don't know if it's sent or not, kind of like a more formal follow-up question to that. Just something that I've been mulling is how it's so powerful how mutual aid really challenges these traditional roles and hierarchies that we set up in so many of our health and social service systems for who is the taker and the giver or the helper or the client, because in mutual aid, you know, it's flat, and you might one day be the person who is providing, and then tomorrow, you know, you're the recipient. And because the Schweitzer Fellowship is framed so much around service, and there's sort of some inherent role dynamics in that, I just wanted to ask you all, you know, if your recent work in mutual aid or over the past 2 years has if it has kind of prompted you to confront any of the frameworks maybe that you know, that you used as a fellow, or if there's some lessons learned for us that maybe we need to be thinking or talking a little bit differently about how we are collaborating, partnering with the community. And, you know, is that service language helpful? Or if you all could just, if you have any particular reflections, maybe from like your time as a fellow for life to now, about those roles and that idea of service, or who's the helper or not.
Yeah, I think as a social worker, it's something that was at the forefront of my education, and questioning that constantly, and our commitment to social justice as a part of our professional values. So it's something I was very aware of even when I was a student and a fellow. And I think I have a student intern now who's a social work student at Tulane in my full-time work. But she was giving a presentation around harm reduction psychotherapy just Wednesday, and really described it as the client is the one driving the car, and we're in the passenger seat along with them. So even in that, there's the inherent, we're calling them clients in our service, in our professional work, but they are the ones driving the car. We're along for the ride, and we're stepping in to support and listen and hold space when and how they want and how they dictate it. So I think that's just a really important perspective that I've carried with me in my professional work, that led to me engaging in mutual aid work. And engaging in mutual aid work makes me a better professional, and I think a better human as well.
The car and the driver and passenger works, that sort of metaphor works so well for so many different things in our lives, right? You know, because just because, you know, someone is driving the car doesn't mean that the other person doesn't say, hey, you know what, we could make an exit here. I need to go to the bathroom, or we need to, you know, pick up a bag of chips or something like that. And it is sort of a destination wherein folks are, I think, having a collaborative conversation, you know, and with a background in dance, you know, this is also like when I teach Argentine tango, I kind of try to explain it in that same sort of framework where, you know, this is a collaborative space. You are putting things in terms of direction and momentum negotiation, sure, but you're also really helping shape this particular sort of this art, right? And in that, I think we also realize that, in being a part of this and being either a provider or a client, we are both provider and client, because the thing is, I think that it's also hard because I think sometimes you think you're either or, you're either the provider or the client, but in fact, you're really both in so many iterations of whatever it is that you do as part of mutual aid. I remember this one time we were moving and I was just so very, very overwhelmed. I think I was it was a very stressful time at work in the hospital. And someone said, look, I just had an abundance of carrots and I made this carrot soup. Would anyone like some? And I said, good God, I would love some soup, just so I didn't have to think about it. This is actually what was happening. We were activated for the hospital. And so we had to have this, we lived in the hospital for about 4 or 5 days. And when we came back, we still had no electricity for 8 or 9 days, I think. And it was just, getting food was just an incredible, insurmountable pain in my butt. And having just folks come to my house and say, here, have this, took such a load off of my brain from something that would have depleted me a lot, such that I could kind of rest and digest from having a very weird slumber party at UMC, taking care of patients. And so that in and of itself is just proof that, you are both provider and providee, and I think that embracing that is such a wonderful play in vulnerability, like Jinx was mentioning, as a way to sort of really sit in the seat of being a community member and not necessarily someone who, gives of themselves, only. Yeah.
Absolutely. I think we have time for one more question from Lisa. I know she's been sitting on this one for a little while, so go ahead, Lisa.
Yeah, sorry, I think there's like someone in a motorcycle, so if you can't hear me, just let me know. So my question has to do with building trust, because a really big part of service, I think, is going to a place that you've never been or meeting people that you've never met before, and then trying to build that trust with the community so that they know that, oh, you're here to help us, and that they trust you to do that. And it's a really fine line, I think, to cross. So I was just wondering, kind of drawing on your experiences. I know, Nancy, for example, you mentioned about a man who was asking for someone to clip their friend's toenail. So little things like that. How did either of you stumble into situations like this, and how did you build trust with the community?
I think usually when you're hearing about things within mutual aid, there's some level of trust. It may not be, and it likely is not full trust, but they're trusting you to a certain point. So with Plan B NOLA, folks are trusting that some random person is showing up to their doorstep and that I'm giving you a pill that really is emergency contraception. So there's some level of trust there, even if that doesn't mean that they want to engage in conversation or, what level that is and what level that experience is. So it's allowing that person to dictate what level it is for them. Is this a really basic level? I never want to speak to you again. Don't acknowledge me. Or can we sit down and have a larger conversation and I can share some resources with you? So there's different levels, I think, there. And I think just sharing more from my social work perspective, but we always say in social work that the relationship is the vehicle for change. So you have to establish that even at some level, whether that's rapport just to hand something off and to know where your location is, or is it something larger, so an ongoing relationship. But building that first and acknowledging the individual or the community, the group first, that has to happen.
Awesome. So then I'll throw it to Lisa, and thanks so much for the discussion on the panel today.
Thank you so much for thank you so much for expounding on your experiences and your answer, Kat. I think Nancy might have had technology issues, but that's if she were here, I would also thank her as well.
Wait, hold on, I'm here, I think.
Oh, okay. Thank you so much, Nancy.
Sorry, oh my goodness.
Okay, so I'm going to wrap things up. But before we wrap up today, I would like to share some upcoming events for any current students who are interested in applying. So applications for next year's cohort are due February 1st. So if you have or you want additional guidance about the application process or their opportunity to hear from other fellows for life about how to develop a creative community project, in my case, I actually reached out to Kat, so this is very possible. Please sign up for our info session. It's I think it's next week, November 10th at 6 p.m. I think Grant will put more details in the chat, but we can go to the next slide. Okay, after the event, please keep in touch. So here are some handles you can reach us. We have a lot of great social media accounts where we share updates about current fellows projects. So that's us, application tips, and various community health resources. And you can always follow us on Instagram at ASF_NOLA, or you can find us on Facebook or YouTube. And that brings us to the very last slide. So as is tradition for our program and for the symposium, we'll close out this lovely event with a quote from our fellowship's namesake, Albert Schweitzer, Dr. Albert Schweitzer. And that speaks to the values of community engagement, trust, and solidarity that we've discussed tonight. So the quote that Grant and I picked was, "I don't know what your destiny will be, but one thing I know, the ones among you who will be really happy are those who have sought and found how to serve." Thank you so much for joining. Be well and have a great week ahead.